Bangladesh. Joining us today, he is the country director of Max Foundation in Bangladesh and is on the board of Max Social Enterprise Limited, which is an innovative water-based piped water business he co-founded in 2019. He led the organization to reach 3 million people with significant impact on the reduction of child stunting through Max Foundation's signature Healthy Village approach. He brings passion for evidence, innovation, and market-based solutions to integrated wash nutrition approaches for child health. He holds a degree in agricultural engineering, a master's in public health, and 2 masters in both water resource development and international relations. So, Mr. Mahmud, we welcome you, and we welcome your thoughts on how healthy village models work with communities to identify priorities and lead interventions.
Thank you very much for inviting me, and also on behalf of my organization, Max Foundation and Max Social Enterprise Limited. It is I'm really happy to be here, and also it's a good opportunity for me to share our experience and how healthy village is designed, implemented, and what kind of experience we gain and learnings. So I would like to give a short brief on that. Particularly, we were looking for a better solution in the villages when we started working with CLTs and also other sanitation programs. That we understood that sustainability, on the other hand, the importance, acceptance, and the responses from the people. These are a lot of variations in the circumstances, context, and also the economic sector. But we also realized that the core point of working with health also deals with the children. Particularly, there is a big opportunity if we work for children, as our vision of Max Foundation to work for children. So it was a kind of a new concept we had to develop or need to learn, that how we can integrate a service that really gives an opportunity for a child to start a healthy life in the beginning. So it starts from the womb of its mother, and then it's at least 5 years to take care. That it becomes a kind of lifestyle exercise that where we need to respond. A child is not only a matter related with the sanitation or safe water, it's also related to food safety, mother, and a lot of things are there. So we start thinking about how we start our day and how we end our day. Within this period, what kind of tasks we do. Then we did some studies, we find that in villages, at least 48, in average it varies, in average 48 behaviors are there which are related to health, hygiene, nutrition, behavior, social norms, even reproductive health, sexual education, etc. Then we start responding one by one, and it became an integration. Though in the beginning it was very difficult to identify that why we start. Then we identify that we have to start from the growth measurement. So we start growth measuring, and then data became a driver. And then we understood that people need to be ignited to set an attitude, and also to address the norms on health, nutrition, safe water, sanitation, everything, and also governance need to be there. Then supplies became a challenge, that every people don't need to be subsidized. Many people have ability to buy from market, and some people need to be subsidized from the social safety net and security, so that it can be an independent way of working. So NGOs cannot be the lifelong supporter for a program. Then entrepreneur became a very important, crucial factor. Then we start training the entrepreneurs. The entrepreneurs start acting, and they start preaching the education, knowledge, and also the awareness. Then it returns both ways, knowledge and improvement behavior, but on the other hand, the products that they sell that make the change. Then it needs to start measuring. Then we set up 18 indicators to measure, and that measured by the local government. Once these are 75% above behavior change in the households, then it is a graduated level, and then 90% above means the healthy village declaration, and they declared by the local government. And we work with an ILG, community clinics, and also many other stakeholders. And now we are trying to scale it up, and it is scaled in Nepal, also in Ethiopia. And some part of that we started with the Rights to Grow platform because it needs a child budget in the union position. So we are advocating now for the investment in child at union level, union position level. So that's the short story about healthy village. Now we're working in south coastal area, also expanding the north in Bangladesh, and Amharic area in Ethiopia. So healthy village, basically integration, and we want that this integration practice better in the community level, at the grassroots level. And it breaks the silo in this way, not on the upper level, because ministries cannot integrate it so easily. But in the community level, integration is very easy. Thank you very much.
Thank you. Thank you very much, Mr. Mahmoud, for your very insightful comments, and thank you also for the excellent work that you're doing. Okay, I now am honored to introduce our next speaker, Dr. Najmus Sahar Siddiq, a public health physician with over 35 years of experience, who is at present working with URC as a technical